Welcome to the Homegrown Podcast every Friday morning at 7 a.m. Mountain Standard Time with your host, Dr. Amanda Ryan, DO, MBA, interventional cardiologist, and an expert in her field. This week's topic, PAD and lifestyle changes. Here she is, our host, Dr. Amanda Ryan.
Good morning and welcome to my homegrown heart. This is your friendly interventional cardiologist, Dr. Amanda Ryan, here in Carlsbad, New Mexico, finishing out our series on peripheral arterial disease. This week on next, actually, we have a special guest in the studio, someone who suffers from peripheral arterial disease, a long-term patient of mine, and I think he'll give us some great insight. But today we're going to really focus on the modifiable risk factors for peripheral arterial disease. By now, if you're following the series, right, you understand what peripheral arterial disease is. But for some of you who are just tuning in today, let me say again, those are blockages, atherosclerosis, a buildup of plaque, cholesterol that are in places outside your heart. Traditionally, we're talking about blockages in the leg arteries, but we can also mean blockages in our neck arteries, abdominal aortic aneurysms. I think we've all probably heard the term AAA before. We may or may not have understood what that really meant. Again, that is an outpouching of your aorta. And if it gets beyond a certain size, which that size is 5.0 centimeters, we know that can actually rupture, and I talked about that last week. Blockages in your kidney arteries, all of those things are peripheral arterial disease. But one of the most devastating forms of peripheral arterial disease are blockages in these leg arteries that can lead to amputations. And as this month has went on, we've continued to really, on our podcast, at our offices, really talk about peripheral arterial disease and awareness. You know, stroke awareness, peripheral arterial disease awareness, there's still plenty of room. There are a lot of organizations out there focused on awareness for these. Partners in Heart Health, our 501 Foundation is very focused on CAD, PAD, stroke awareness projects. As a matter of fact, again, we had another screening this week at Artesia Senior Center. Shout out, we actually had 44 patients, 30 of them people who are at risk for peripheral arterial disease. So we really got the exact population we were looking for there. Artesia Senior Center did a great job of helping us. They were very happy to host us. They really got the word out to their clientele, and it really helped us get those patients that were most vulnerable in their community. So we're very excited to see those patients and help further evaluate them. Shout out to my team, which included Ashley Armijo, Michelle Rain, Jonte Lewis, and Sol Rodriguez, who went and really screened these people. We had no idea we would have 44. That's a really good turnout. We'll be excited when our senior center here in town, the new one, is up and done too, so we'll be able to do screenings there as well. But again, you want to keep away when you're doing health fairs of doing them at the places where you're going to attract a certain socioeconomic group, but not others. You know, we really are out there trying to reach our most vulnerable population. And as part of that, you've really got to go into the communities. So I think we have next Wednesday at Hobbs Senior Center, and the following Wednesday to close out the month at Roswell Senior Center. So we will be having events at all of those. So if you know anybody in Lee County or Chavez County that would be appropriate to screen for leg blockages, again, diabetic, smoker, high blood pressure, all of those things, they would be great to stop by our screening, anyone that's having any leg symptoms or would like to be evaluated. What do we do for some of our patients that have blockage in their legs? Again, one thing we can do are fancy procedures. And we showed a little bit of that on our last couple episodes as well. And I'll share with Danny, my gracious host, some more pictures this week. We actually did 5 cases this week where we cleaned out blockages in people's legs. Excellent results. And we enjoy doing those procedures. But, there's always a but. What we really want to do is, number one, prevent disease if we can. And number two, definitely from a secondary prevention standpoint. There is a lot of room in peripheral arterial disease work for secondary prevention to improve. What does that mean? It is not uncommon for work in people's legs to be done over and over again, because oftentimes they do not change those modifiable risk factors, and we do not have the kind of equipment that can really fix the situation long term. We work very closely with Dr. Paoni and Dr. Raja, who I've spoken about before, on our PAD treatment options. But there are no treatment options for the legs that have really lasting results, particularly if we don't stop smoking, we don't control our sugars, and we don't walk regularly. Now again, what is a walking program for somebody that has significant peripheral arterial disease in their legs? There is a program, actually I'm going to speak of directly, called SET therapy. What is SET therapy? It consists of sessions that last 30 minutes, comprising a therapeutic exercise program for PAD patients who have claudication. That's cramping in the back of your calves. Again, classic claudication. You walk, you get cramping in the back of your calves. You stop walking, in about 10 minutes, that goes away. You start walking, within about 5 to 10 minutes, that pain comes back. Those are classic signs that you do have blockages that are significant in your legs. But I've also said that like a third of people actually have claudication. Some people have claudication, so they just stop walking. Other people don't get traditional symptoms. Same as blockages in your heart's arteries. Again, I'll hammer this home as long as this podcast lasts, which I hope is for years to come. Women and diabetic patients often don't get classic symptoms for heart disease either. Only about a third to one half of women who are having a heart attack actually get chest pain. So with that being said, what is SET therapy again? So we've got this therapeutic plan that's going to be conducted by an outpatient setting, hospital, or physician's office, be delivered by qualified personnel to make sure that the benefits outweigh the harms, and they have to be trained in exercise therapy for PAD patients. So this SET therapy basically is 36 sessions of specific exercise for PAD patients. So it's similar to a cardiac rehab program, but tailored for those patients with significant blockages in their legs. And I've said this before too, and I will continue to say it, 3 to 5 minutes of walking 2 or 3 times a day might be the best that a significant PAD patient can do. So their walking program, again, does not have to be walking an hour, running a marathon. We're talking about walking for 3 minutes. And I bet a lot of you are sitting there thinking like, that's like nothing. But I'm telling you, first of all, if you haven't exercised regularly in a while, go walk for 5 minutes straight. It might be harder than you think it is, particularly as we age. I talk to my patients a lot every day saying if you don't move, you won't be able to. And that's very true. Again, I've said this as well. I often leave the office at 8:30, 9 o'clock at night. Last night I told my mom, it's been, again, a very busy week of helping patients with leg blockages. And I told my Mom, I'm coming by to get you if you think we can walk. You know, again, it was 8:30, quarter till 9. We were both still working. She was working at home so the dogs could have some mom time for a few minutes. And I was still working at the office. And we went to the beach and we walked. Did we want to, quote unquote? Want is an interesting word and emotion. I think we needed to. And we had a great walk and we needed that release. But did we really want to do it? No, we really didn't. We were tired and we wanted to just take a shower and go to bed. Sometimes you have to pick your health over your immediate feeling. And there are days when my immediate feeling does win the battle. Some days are a self-help journey, and some days we're just trying to make it to the couch. And I told a couple of my staff that this week who were having some real personal struggles. And they said, I'm sorry, I kind of broke down, or It didn't seem like I was doing the best I could today, but I have other things going on. And I really looked at them and I said, girls, remember, some days are really a self-help journey. You are really looking at yourself, your life, where you can improve, what you can do better. There are other days where really it is like, I just need to go to bed or go sit on the couch. I don't have a lot more energy. And that's okay. We are so hard on ourselves in America, especially women, especially young women. I think as we get a little older / wiser, we do get a little more forgiving of ourselves. However, young women, I feel like, have so much pressure in America to be perfect at everything they do. Perfect job, perfect spouse, perfect mother, perfect figure. It's just very hard to keep up with that expectation. So sometimes there are the days you've got to dig deep and make yourself prioritize your health. Then there are days where I feel like you have to understand where you're at in a journey and that you're doing the best that you can. But every time I see my patients in the office with peripheral arterial disease, or our nurse practitioners do, we take the time to talk to them about a walking program. What is NUPAC? NUPAC. That is the New Mexico Nicotine Use Prevention and Control Program. It is an amazing program. Sometimes I'll refer to it as the 1-800-QUIT line, but it has so many resources for patients that smoke or vape or use smokeless tobacco. And it will literally, there is endless counseling available. No matter how many times you've tried to quit before, they have resources. They sometimes run out depending on the situation, but they do have starter packs of nicotine patches, of gum, of sessions with hypnotists. They have so many different resources, and it is really a great program. I'm going to tell you that their mission is to improve lives by eliminating the harm from tobacco use and nicotine addiction, using an anti-oppression framework and effective strategies that reach, involve, and mobilize individuals, organizations, and communities to develop policies, systems, and environmental norms that support nicotine-free lives. Wow, what an organization with a mission near and dear to my heart. But it does work. Again, you can't smoke inside almost anywhere in California for quite a few years. And the last study I saw, which is probably a little bit old by now, they've decreased their smoking rates by at least 7%. And California is a very populous state, so that's quite a few people that have stopped smoking. And some of that is definitely, if you can't smoke in any of the public places, you are, yes, less likely to smoke in general. So, sorry, I am a complete advocate for smoke-free as public facilities. And that's twofold. Yes, I'm an interventional cardiologist. And yes, I think I've mentioned that I'm allergic to cigarette smoke and I get an immediate headache and nauseated. And I have to deal with it until I go to bed that day, which is a lot. But it's also because I see the devastating effects of cigarettes every single day in my office. And it's just painful to see and watch. And again, everybody has a dear grandfather. I feel like that I hear a story how they smoked 2 packs a day and 3 packs a day and they lived to be 90 and that kind of stuff. And again, yes, there are people like that out there. Of course, they probably worked hard and had a very different diet than what we have too. But smoking in this day and age, particularly combined with our Western diet and lack of activity, is truly devastating for cardiovascular disease. And as providers, using these resources that we have with organizations like NUPAC is very important to keep patients on the right track with smoking cessation. Again, how many times does it take to actually quit? There's a lot of studies. I think 5, 6 times probably of people making the commitment, but every person is different. I had a younger man, he was about 47 in my office the other day. He had a heart attack about 8 months ago, and he had a stent put in. He stopped smoking that day. He's had no trouble. I asked him, was it hard? He said, no, it was not hard. He said, I don't know, I just stopped and it was done. I don't know. I have my dad. I don't talk about my dad that much because he's just a very quiet, reserved man. My dad is a really special person for a million reasons. He is supportive, loving, encouraging. Again, dropped me off at school when I was 5, came to my last graduation. So he thought when I was 35, then I went and got an MBA, and I tell him I'm going to law school in my 50s, so we'll see how that goes. But nonetheless, my dad smoked for years. And when he did stop smoking, I think he'd been smoking for, again, about 20 years, maybe a couple more or less. And he said to this day, a lot of times on a daily basis, he wishes he could smoke a cigarette. It's a very addictive habit. My dad's a strong man. He didn't eat a carbohydrate for 5 years when he was getting healthy. So he can do what he wants to do. And he continues to not smoke. But he says the psychological addiction to cigarette smoking lasts a lifetime for many people. The physical addiction to nicotine lasts about 3 days. But again, it is I smoke when I drink coffee. I smoke when I get up in the morning. I smoke after I eat breakfast. So it's those things that it's a habitual situation. So it's the same reason. Do we stop at McDonald's whenever we're leaving work and it's 9 at night and we see McDonald's and we're kind of hungry? Do we really think that's our best food option? I mean, no. If you're me, the answer is no. And 9 times out of 10, I don't make that decision. But every now and then I am like, oh, I'm just going to eat a cheeseburger because it's late and I'm hungry. Sometimes our logical selves give way to our impulsive selves. We're all prone to different impulsive behaviors. And I think we have this overall fear of even admitting stuff. Again, this idea that we have all of ourselves, quote unquote, pulled together, that we always have ourselves pulled together. I hope when you're watching my podcast, or if you're in my life as a patient or a colleague or a friend, I hope you know that I don't have myself all pulled together. And I think I'm doing the best that I can every day to do the best I can to serve others and myself and what I believe to be a God-driven mission in healthcare. But I do not have all the answers. I do not win every battle within myself. Every day, I struggle to be the best me that I can. And I challenge you to struggle every day to be the best you that you can. I love having my mom here working with me. Tricked her again into that semi-retirement mode where she's working 100 hours a week. But the patients love my mom, the staff love her, and I love her. And she is contributing so much to this community. I don't know if people of Eddie Chavez and Lee County realize, again, that my mom is a 40-year nurse with a long background as a healthcare executive. And she has years since she was really at the bedside, but she went back to during COVID because she really, A, had to, and B, felt compelled to do so. After doing that, she just really struggled to go back to her corporate America position, but she wasn't really ready to retire. And that's when her and I were like, I was like, do you want to come help me get this project where it needs to go? Because I was struggling a little bit to find nursing leaders. And she said, yes, I would like to. And it has been a 2-year ride. And again, she says she has about 18 more months in her to really help us get this project where it needs to go. We are doing our very best to support some of our own going to nursing school. We are trying to attract more healthcare professionals. Tammy Wacker, the head of our foundation and marketing and outreach coordinator, is really trying to work with our local college to come up with a plan for how we can get more healthcare careers going in our communities. This is really a crisis. I want people to understand that in order to have sustainable, high quality health care in our communities, we absolutely have to train our own. It is very difficult to get people to move to our remote areas in order to work in our healthcare sector. There is a national shortage of healthcare workers. I saw the other day an article again in Becker's, which is kind of, again, Wall Street of healthcare, saying that we'll have a shortage of 100,000 medical assistants by, I think, within 5 years. 100,000 medical assistants, those are the main people that are helping us on the ground level in our offices and hospitals take care of patients. Where are we going to get those 100,000 people? And where are we going to get them in Carlsbad, Artesia, Hobbs, and Roswell, and our surrounding communities? Jowl, Eunice, again, where are we going to get these people? We have got to take young men and women from our area and give them every resource and every chance for success. And that does require thinking outside the box sometimes. Again, when I'm talking to my foundation, amazing board members who have supported everything for me at our casino night, which is Saturday night this week, our Hobbs Heart event, which is a walk outside, encouraging CAD, PAD patients to get out there and walk for their health. That's the 21st in Hobbs at the college there. We're going to get these people by helping support them while they get an education. There are a lot of programs to help pay for tuition. There are student loans available. That's all true. But when we're talking about young working people, often we're going to have to help with their living expenses too, which are very high in our current society. You know, I talk to my staff too about, in some ways, and this is not an attack on the system, but this traditional 4-year college, go away, your parents pay for all that, you go study, psychology for 4 years and grow as a human being and then decide what you're going to do in life, etc. That's not realistic in our current era. People are struggling to pay their bills on an everyday basis. Small businesses like us are struggling to pay people enough so that they can really thrive in today's society. I think the days of people saving money to send their kids to 4-year college is going to be a very elite group of people. I think that's going to be very hard for the middle and lower socioeconomic class of people to accomplish. I also don't think 4-year university is appropriate for every single person. It's definitely not appropriate for every 18-year-old. Again, I spoke of this innovative program that Memorial Hermann in Houston came up with for a healthcare high school that's going to enroll 800 students in the next few years. I think that's a great idea. Again, out here with our foundation, we are trying to hand select some of our healthcare professionals that want to go on and get further advanced or varying degrees. We want to support them with part-time work, with flexible schedules, with living expense money, as well as tuition reimbursement. We want to help them so that they can help you. As our population ages and our life expectancies continue to increase, yes, it went down a little bit with COVID overall in America, but as we've gotten control of that, our life expectancies have continued to increase. As we live longer and longer, we need healthcare workers to take care of us. And I am reminded every day in my practice that health is truly wealth. You can have all the money. You can have all the career. You can have all the family love and support, which are all very, very important. But if you don't have your health, you really don't have anything. And that's the truth. So the importance of prevention to help, again, obviously, prevent things from happening to you from a health standpoint, as well as that secondary prevention. How in someone that has already developed some sort of disease, how are we going to alter those modifiable risk factors? Let's switch to diabetes. Diabetes is epidemic in southeast New Mexico. There is a genetic predisposition. It is particularly common in our Hispanic and African American populations in our region, as well as our indigenous people, which is a little more limited population here, but larger in northern New Mexico. Diabetes is epidemic in all of those populations, as well as our Caucasian population. With that genetic predisposition, what can you really do to alter your diabetes? Is developing peripheral arterial disease, coronary artery disease, strokes, kidney problems, eye problems, is that inevitable with diabetes? And that's an interesting question. It is my belief if we controlled, especially type 2 diabetes, very tight control of type 1 diabetes, we're seeing with the advances in technology, the medication improvements, the different insulin options, the different tracking options for diabetes, that we can delay or prevent many of these gruesome outcomes from diabetes. But you've got to partner in your own health. Whether I'm talking about Advanced Heart and Vascular Center of New Mexico, Partners in Heart Health, or Advanced Ambulatory Surgery Center of Carlsbad, New Mexico, you will continuously hear me use the word partner. We've got to partner in your health. We've got to partner with the community for resources. We've got to partner with larger organizations who can help provide grant funds so that we can help partner with more patients. That's the whole goal of our organization, is to improve the cardiovascular health in our community and surrounding areas with a commitment to excellence in all that we do. Again, with transparency, quality, cost-effective measures being at the forefront of what we're trying to accomplish. There is still such a knowledge gap in diabetes. It's getting better. Again, we have a diabetic specialist. We have several providers who focus on diabetes education, but there are not enough of them compared to the number of people in our region that have diabetes. Hemoglobin A1C. If you are diabetic and you do not know your hemoglobin A1C, you don't understand it, or you don't focus on it, then you're doing yourself a disservice. Hemoglobin A1C monitors your average blood sugars over the last 2 to 3 months. A well-controlled diabetic patient has a hemoglobin A1C of close to 6. I had a 38-year-old gentleman in my office the other day. Somewhat for a different reason, he got a virus that affected his heart and gave him what's called pericarditis. That gave him pleuritic chest pain, and it was an inflammatory condition, and he was recovering well from that. But he is diabetic, and I talked to him about checking out his risk factors, just because he did have diabetes and he was obese and 38 years old. And I asked him what his hemoglobin A1C was, and he said, he kind of stumbled around the question a little bit at first. Like, well, I don't know what, it was a lot better, but now, and I was like, and what was your hemoglobin A1C? 11.8. I was like, 11.8? Okay. That means his sugar's running about 450 to 500. And he feels fine. At least he thinks he feels fine. He probably doesn't know what it really is like, but he's like, no, I can kind of tell, like, I don't feel right. I can't really totally put my finger on it, but I'm sluggish, I'm fatigued, I'm just not. He's like, but I'm going to do better. I'm really. By the way, he goes to the gym and he lifts weights and stuff. I'm like, no, okay. You might be on a muscle strengthening program. You've got to get on a cardio program. If he's just like, I'm not really watching my diet. It can be very hard to control diabetes, but you've got to do your part. You've got to commit to your health. You've got to understand the importance of making a difference. You got to make a difference in your own life and your health every single day. So again, I feel like a walking public service announcement this week for PAD prevention, which primarily focus on smoking cessation and diabetes management, walking programs. I'm proud of our organizations and how much we focus on changing the cardiovascular health of people in Southeast New Mexico, and I appreciate everyone who is on board trying to make a difference with us. And we'll be back next week with a special guest, and I look forward to that session as well. Have a great week.